My people, if you have a bad phone, you can always return and ask for a refund. If your tailor handles your fabric wrongly, you can get another. But same is not with your health. Quack nurses are like a bad phone, but unfortunately, life does not have a duplicate.
Human life is too precious, and committing them into the hands of a quack is very wrong. A quack lacks the license to practice as a certified nurse or midwife, thereby making such a person incompetent to carry out basic nursing procedures. A quack lacks professional and ethical conduct to carry out care for those who are sick. Since lives of people are involved, we cannot continue to watch as quackery adds to the further breakdown of our health care system. If you have ever experienced the consequence of being attended to by a quack, you will know why it is important that quackery comes to an end. Now, quackery is the promotion of deceitful and ill-informed medical practice. A quack is a fraudulent or an ignorant person who pretends professionally or publicly to have skills, to have knowledge, qualifications, and credentials that he or she does not possess. Quacks use unscientific procedures and practices and deceive clients or patients who don't know their rights or who don't know the right kind of people that they should get care from. A nurse is an individual who has received a formal education, acquired skills, attitudes, knowledge, and has become registered by the Nursing and Midwifery Council to promote health, to restore health, and to rehabilitate individuals, families, communities independently or in collaboration with other members of the healthcare system.
Yes, we do not have enough nurses, but we've got academic institutions good enough to train more. Yes, we are overworked, but we'd rather be than jeopardize the health of our fellow citizens in the hands of quacks. The human body, just so you know, is too delicate and complex to be tampered with by totally untrained and unprofessional individuals who assume that completing an apprenticeship training under a physician or a pharmacist equals passing a Nigerian Nursing Council final qualifying exam. No wonder mortality and morbidity rates are alarming. No wonder malpractice and medication errors have become a plague, even though many go unreported. And as for these individuals in question, I know you love the job and you want to help, but please do it the right way. Go to a nursing school. Yes, you can. Attend classes and clinical postings. Yes, you can. Write your final qualifying exams and pass because you can. Our lawmakers even need to propose bills that criminalize quackery in order to serve as a deterrent to aspiring quacks. This will further preserve the health of the precious citizens of Nigeria. This way we can't be sure our health is in safe professional hands.
Quackery in the healthcare system is gradually becoming a norm, and you will agree with me that it is quite difficult to differentiate a quack from a professional by mere looks. So many hospital managers are engaging the services of this quack in many hospitals today in order to cut costs. There are so many negative impacts of quackery to the healthcare system and to everyone accessing healthcare in facilities where quacks render healthcare services. So many women have lost their lives in pregnancy. A lot of patients are mismanaged and misdiagnosed. Nursing education is beginning to lose its value in Nigeria.
Quack dispense their care in an unprofessional and harmful manner that increases mortality and morbidity rates in the society. The consequences or effect of quackery in Nigeria goes thus. There are unprofessional acts such as abusive way of attending to their patients or paints the licensed nurses as irresponsible. Their mode of dressing also paints registered nurses as people who dress shabbily and attend to their clients in a shabby manner. Also, quacks carry out procedure in an unprofessional manner. You can see them giving injection in an unprofessional way, and also the harm they do to the community is more than the good. They complicate patients' condition before finally referring them to expertise for further care.
Do you know that if a treatment of a quack jeopardizes your health, you cannot sue because she doesn't even have a license to show? Do you know that licensed nurses are not trained by doctors and hospitals, but by certified and accredited schools of nursing and universities in Nigeria, with a minimum of 3 to 5 years intensive training, both in the theoretical and practical aspects? Don't be fooled. Know your rights. Request for their license before you get treated, or they could give you a death sentence. The license is not the hospital ID card. Let's get it straight. It is a plastic ID card issued by the Nursing and Midwifery Council of Nigeria with the nurse's name, the phone number, and unique registration number.
I understand that poverty, greed, illiteracy, poor supervision of our health institutions, misconceptions about this profession, and poor penalty or punishment for quacks are some of the causes of quackery. This is why we all use this medium to reach out to the public, to the government, and to other governing bodies to help us provide lasting solutions to this problem. National policies should be formulated in line with state and local governments to reduce quackery and promote professionalism. Laws prohibiting quackery should be put in place with tough punishment for those that violate them. Nursing education in federal and state schools of nursing should be subsidized in order to make it affordable for those that have passion for this profession but are not financially buoyant to acquire it. Hospital owners should stop training quacks and employing them to care for their patients. Government and other organizations can support student nurses with scholarship schemes to encourage students who are brilliant but less privileged. Together, we can ensure some sanity in our healthcare system.